Hi, my name is Damien Mayer. I'm one of the surgical registrars at Poole Hospital. I'm one of the junior doctors. I'm striking over the new contract which is being negotiated currently in its current form, with a number of difficulties and areas of disagreement between the BMA and the government. It's, in my opinion, not safe and not appropriate to be brought into force in its current form. I don't think this is purely about saving money. I think what they're trying to do is expand a service which is currently working during the week, what we call the elective service. They're conflating that with an emergency service which already operates 24 hours a day, 365 days a year, and they're trying to expand the amount of doctors' hours worked, but for the same pay, so therefore effectively getting more work for the same money. Jeremy Hunt has also called into question via various routes our professionalism and our sense of vocation. Personally, I'm working 91 hours this week. I routinely stay late for the care of my patients out of my own choice. This is not an imposed sanction. This is what I do because I believe I give the best care possible to my patients. If my sense of vocation was lacking, I would clock in and clock out at my allocated hours, which I do not do. I said, I don't know a single junior doctor who doesn't work above and beyond every day they work and any time they're required to make sure that care of the patient is not at the forefront of their minds. The next point that Jeremy Hunt talks about is the increased mortality at weekends, which is factually incorrect. The study he quotes, which has been looked at by 50,000 junior doctors who are trained in analysis of complex statistical papers and also medical statistics, states that less people die at a weekend if they are in hospital. What the stats do show is that there is an increased mortality within a month of patients coming into hospital, which probably reflects that the people that come in at the weekend are only emergency patients. We don't currently do elective work at the weekend routinely. Therefore, the patients who come in at the weekend are the sickest and patients who need the most care, which they get the same care on a Monday, Tuesday, Wednesday, Thursday, Friday, Saturday, Sunday. The emergency service, especially in my department, is exactly the same 365 days a year. On Christmas Day, you will have the same emergency team as you would have on any Monday or Tuesday the rest of the year. So it is factually incorrect to say that more patients die at the weekend, because the stats don't show that, and it is incorrect to say that doctors opt out of any working hours. We don't. Well, I think obviously it was dismayed by all the junior doctors, being told you're going to have a contract imposed upon you when you're in negotiations, therefore invalidates any negotiation. It's not a negotiation if it's going to be imposed. And at that point, as far as I'm aware, obviously being a non-BMA committee member, I believe that the negotiations were still at a point when people believed there could be some sort of compromise reached. And when we were told it was going to be imposed, the general body of opinion was that this is no longer a negotiation, and therefore we're going to have anything, whether it's safe or not, or better for patients or not, imposed upon us, which obviously caused us to have a stronger feeling towards the action we would take against that contract. Lying would be intentional, and I don't know if he's actually lied or he's unable to differentiate between some of the points he's actually made between the myths and the reality. Jeremy Hunt's had some factually incorrect statements he's made, which are categorically not true. I don't know, obviously those are the sort of negotiations that carry on behind closed doors. However, there's multiple factors to consider. We know for a fact that privatisation is a part of the NHS currently. You've got about 10% of the budget currently being in private hands, and you've got some of the largest private contracts ever in the NHS being awarded to private firms, such as Virgin taking on community mental health for young people. You've got increasing competition via the Health and Social Care Act, with private companies being allowed to compete on the same footing for NHS contracts, and you've also got things coming in the future such as TTIP, which mean that there's going to probably be more competition around the NHS, some of which may be beneficial, some of which may not. We're only going to be able to see that in the future. Personally, my personal opinion is that privatisation is going to become more common in the NHS, and I believe it's probably going to lead to more fragmented care within the NHS. The first thing he said, which probably was one of the most dismaying to the junior doctor cohort, was about us being able to opt out of weekend working. We do not. Our contracts cover us for 365 days a year. There's not a single junior doctor in the country who has an opt-out clause in their contract. We all work the emergency service. Emergency care in an NHS hospital is every day of the week, every day of the year, and we cover that 24 hours a day. This is not about improving emergency care. We already do that to the best of our ability every hour of every day of the week. So Jeremy Hunt was factually incorrect when he talked about doctors being able to opt out.